will start with drugs for peptic ulcer diseases. Very common disease and a very important topic in pharmacology. Peptic ulcer disease. What are the drugs used in the treatment of peptic ulcer disease? Peptic ulcer is caused by excess secretion of gastric acid. Now, gastric acid is secreted by cells in stomach called parietal cell. तो parietal cell से gastric acid secrete होता है. तो if we draw the diagram of parietal cell, a very simple diagram of parietal cell, if we draw, so suppose this is the parietal cell in stomach. This is secreting acid. Acid is nothing but H plus. This is secreting H plus or proton into the gastric lumen. So this structure that you see that is secreting H plus is called proton pump. Proton pump, which is secreting H plus into the stomach lumen. Now there are certain substances which increase the secretion of gastric acid or H plus. So on this parietal cell we have receptors for histamine. So we have H2 receptor, histamine type 2 receptor. On this receptor histamine will act on these receptors and stimulate gastric acid secretion. So histamine is one stimulus for secretion of gastric acid acting via H2 receptor. Then we have another type of receptor on gastric acid. This is the muscarinic receptor. Muscarinic receptor, and muscarinic receptor is stimulated by acetylcholine. So muscarinic receptor stimulated by acetylcholine, and that will also stimulate acid secretion. Then we also have the gastrin receptors on the parietal cell, and they will also stimulate secretion of H plus. So there are many substances which increase the stimulation of gastric acid. So we have some drugs that are called, number one type of drugs that we call as anti-secretory. Anti-secretory are those drugs that will decrease H plus secretion. So they will decrease the secretion of the acid, H plus secretion. These drugs will decrease. So what are these simple drugs? We can block this receptor, number one drugs. So you will have H2 blockers. You can block muscarinic receptors. So you will have muscarinic blockers, anti-muscarinic, or we will see that we can block the proton pump itself. So we will call them proton pump inhibitors. Proton pump inhibitors. They will directly inhibit the proton pump itself. Okay. So these are the three main anti-secretory drugs we have: H2 blockers, anti-muscarinics, and proton pump inhibitors. They are all collectively called as anti-secretory, decreasing the acid secretion into the stomach. So let's discuss these three important drugs one by one. Okay. तो ये parietal cell है. Parietal cell पे histamine के receptor हैं, acetylcholine के, और proton pump है. हम इनको बंद कर सकते हैं. That will decrease gastric acid secretion. Let's take them one by one, starting with the first drug. This is the most important drug, most effective drug, and called as proton pump, proton pump inhibitor. Proton pump inhibitor. Okay, so let's see this important class of drugs. How do these drugs act? Number one, these drugs are given as oral enteric coated tablet or capsule. So they are given orally or IV. Enteric coated, that is the one word which is important and asked in exam. Enteric coated, they have a coating. Enteric coating means that this coating will dissolve only in intestine. Okay, so this enteric coating, this will dissolve in intestine